Let our meeting come to order. Good afternoon. Welcome to the Budget Subcommittee on Health and Human Services. This afternoon, we'll have a very robust discussion on a number of topics in the Department of Social Services, and we look forward to that discussion. From the looks of our committee, we can dispense with calling the roll, but I do want to alert you that we have several committees, policy committees, that are meeting simultaneously, and our members are part of many of those committees, including the chair. I'm a member of two committees that are meeting as we speak. I've chosen to be with all of you, but at some point I will have to duck out to vote in those committees. And so we'll have some moving pieces today, but we have a very important conversation, a number of important conversations. We want to hear from everyone. As always, we ask the same thing. Give us the high-level overview so we can spend the majority of our time on questions and discussion, and we always look forward to hearing from the public. With that, we want to begin with issue number one, child welfare services and foster care, the continuum of care reform, and governor's budget proposals and issues. As always, we are glad to welcome our director, Mr. Lightbourne, who is here. We understand that others may join us as we do this conversation, and we welcome them. Frank Mecca from the County Welfare Directors Association, and we'll have representatives from the LAO's office and the Department of Finance. Director Lightbourne, whenever you are ready.
Thank you, Chair Thurman.
Thank
Good
you.
afternoon. I'm going to do a quick sort of overview of where we are with CCR at this point. First, I'd like to really commend staff for the staff summary. It's very elegant layout, and it's a very good characterization of the ongoing collaboration around assumptions and methodology that we are engaged in with our partners. One minor technical thing was just pointed out to me on page 6 on the realignment characterization. In the event of federal or judicial policy changes, those cost increases are shared between state and counties. Where we sort of are at this point, of course, AB 403 is the primary implementation mechanism for the continuum of care reform. And 403 sort of lays out, in many respects, the staging as we move forward. So for both the child welfare context and the juvenile probation context, the first order of business is identifying and engaging and recruiting alternative places of care for youth who would otherwise be in non-therapeutic congregate care. It then it starts the process of transitioning youth from non-therapeutic care, allowing for respect for individual youth voices and the possibility of some extensions of lower-level group homes beyond January 1st. Simultaneously, it starts the process for licensing, accrediting, and certifying short-term therapeutic residential programs and assessing the needs of youth now in care who may need to be in either residential therapeutic programs or in therapeutic foster care placements, which is also a process that's starting. The agenda indicated Sarah Rogers was going to be with us today. She's actually at a therapeutic foster care work group meeting in the Bay Area with outside experts today. So
if they're bringing money back for us in the state, we're okay with that.
Good. We then move on to the accrediting and certification of foster family agencies and sort of the process by which services can be delivered to the family-based placement, the home-based placement of youth. These are the first-year activities. Extraordinarily close collaboration and coordination with the stakeholders. There are county-state teams, multiple county-state teams meeting regularly, most convened through CDSS, the mental health team through DHCS, biweekly calls with our county directors to update. We've developed implementation templates to help county directors work with their deputies to look at the steps needed for implementation and develop dashboards indicating status of deliverables from CDSS in the process. In I'll just close by saying, in visiting the counties that we've had a chance to be in the last month or two, they have very active work groups already engaged. And I mentioned to Mr. Thurman the other day, had the pleasant experience of being in one of our largest counties, San Diego, who has a children's shelter, which under the terms of 403, the use has to change, and they are already reducing their average length of stay in the children's shelter there to 10 days. So they are 8 or 9 months ahead of schedule at this point. We're going to have to stay very nimble as this moves forward. And one thing I wanted to address, because it was a question in the staff report regarding the rates process and establishment. We have developed a rates structure approach, which has been shared with providers, counties, other stakeholders. The actual dollar equivalent of those rates is something we will have to process with throughout the administration, and I anticipate that that detail will be available with the revision. Thank you. Mr. Rose can...
I'll touch on two other things that you've asked in the agenda. The first of which is the implementation of the foster parent recruitment, retention, and support. Again, the agenda lays out a lot of useful information about the implementation. A couple of things I'd touch on. It's a total of 54 county welfare departments submitted plans, 10 of which included a joint plan with the probation department, and 12 probation departments submitted plans for the funding. The agenda does describe a number of the supports and strategies that that counties suggested they would use, and I would say that the most important thing to mention about this year's budget is it includes additional funding for probation departments specifically. So it includes $17 million for county welfare departments and $15 million for county probation departments. Our hope is, and our intent and guidance has been to work together across the local government to recruit and retain and support foster parents and relatives. Should also note that we did a plan process where we asked each county to submit plans, and the total dollar value of the plans significantly exceeded the amount that was in the budget. The other thing you asked us to touch on was our state operations resources. And so as Director Lightbourne mentioned, there's a number of activities going on, and again, the agenda does point out a number of them. We jump-started our process by moving 34 people from different parts of our department into an integrated team that focuses on the activities that Director mentioned. We have folks in the children's division, folks from licensing, administration, and legal support to do all those various activities. AB 403 called out 223 some procedures and processes and protocols to deal with, and a whole host of stakeholder work to do. So we've jump-started the work by establishing this team, but we'll need continued funding for the immediate short term to keep the work going.
Thank you. Same question. We've had a moment to touch base on this briefly. If you could, in a snapshot, let us know about the continuum of care reform. Let us know what's working well, what gives you hope, what's still a work in progress, and from your view, gives you heartburn and still needs some more work. And what do you see as what we need to put our main focus on going forward?
In terms of what gives me hope, it's the sort of energy that all of the partners are bringing to this. And as I mentioned a moment ago, sort of the examples of the working teams in the counties that I've had the opportunity to spend time with in the last month or so. And the wonderful example of, the reduction of time kids are spending at the Polinsky Center. What is work in progress is everything. All of these are moving pieces that are significant changes in what we do, what counties do, what probation does, and sort of the whole process of identifying and securing the family home placement resources and the relatives. What's been sort of struggling, and I'm sure Mr. Mecca will speak to it in a second, is we spent a lot of time since the governor's budget, January 10, clarifying assumptions and methodologies. I think we're I would say very close, but there's still some air. And that's obviously work we have to complete in the next days as we move forward. Several things. Whenever you're engaging a wide stakeholder process, you're going to get suggestions you didn't expect, and you're going to get concerns that weren't anticipated. And so a couple of items, like around selection of an assessment tool, were slowed down to allow consideration of alternative approaches and things like that. But in all of those steps, I think ultimately it's value added, and it's just time we have to make up as we go forward.
Thank you. I'm sure that Mr. Mecca will also share his highlights plus other things, but we'd be interested in your viewpoint as well as you make your remarks, what's working, what needs more work, and where do we go next. We welcome your presentation.
Thank you, Mr. Chairman. Frank Mecca with CWDA on behalf of the County Human Services Directors. And I should start by saying that we've been enthusiastically in support of the direction of CCR since before it was a bill. We were sort of co-chairs of the working group that came out of budget language that gave rise to it. And so the elements of it, the direction it's going, and ultimately what we think it will produce for children is it's the right way to go. And as Mr. Lightbourne pointed out, there's been an extraordinary amount of effort and energy to being put forth by all parties. And I'm speaking now for our colleagues in probation and behavioral health and at CSAC as well, with whom we've been working. As Mr. Lightbourne went through all the different components of it, I think it's obvious that this is a huge lift. This is a major, major effort, and all major efforts are difficult. None of them are easy. From CWDA's standpoint, we're completely committed to working as hard and as fast as we can to be able to implement this well and get the outcomes that you expect. From our standpoint, CCR will succeed or fail based on whether or not we have an adequate, well-supported supply of family home alternatives for kids after they've received whatever short-term treatment that they get in an institutional setting. That's a major issue for us. A second big issue is whether or not we'll have the staff capacity to do the intensive team-based case management for every kid in the child welfare system, which is required by CCR, which again is the best practice model. And third, it's the cross-system collaboration with many other systems, principally behavioral health, to make sure that the child welfare system and the behavioral health systems are working in concert so that the children who are being stepped out of institutional settings and while they're in institutional settings can get the behavioral health supports they need to thrive and to be able to sustain themselves with a family, which is, and hopefully with a relative if possible. And so I just give you that backdrop to point out that from a resource standpoint, it's really important for us that we adequately resource the program so that counties can be successful to get the outcomes that everyone needs. And those resources are around the staff support to do child and family teams and the recruitment and retention supports that we need to help bring family caregivers into the system and to support them. Training, respite, assistance with health services that they can't otherwise obtain, normalization activities like soccer or cheerleading or things that can really help a foster youth thrive. It's the whole gamut, recent research by UC Berkeley looking at your recently enacted ARC program asked caregivers sort of, what do you need? What types of supports do you need? And that research really bore out what the counties in the state and our partners have been telling us, the type of support that caregivers need. So while the governor's budget acknowledges that staff support and support to recruit and really support family caregivers are important elements for CCR success. And since the January budget came out, we've been in discussions with the administration pretty intensely to try to come to consensus on what the workload actually is going to be and what is the appropriate amount of funding. I agree with Mr. Lightbourne. There's been a lot of progress in those discussions. We're not all the way there yet. And getting all the way there is incredibly important for us. There is some daylight, but we plan to continue those conversations continually up and through the May revision process, because it's our hope and expectation that by that time we have consensus so that we can all focus on the incredible amount of work that everyone's doing to be ready to implement by 1/1/2017.
Thank you, Mr. Mecca. Is there anything from the LAO's office?
Yes, Mr. Chair. Ben Johnson from the Legislative Analyst's Office. And as we wrote in our analysis of the Human Services budget, we do believe that the governor's proposal is the reasonable first step in the implementation of the continuum of care reform. Nevertheless, we'd like to highlight several issues that were also raised by Mr. Lightbourne and Mr. Mecca. The first being the assistance payment rates for providers and resource families that have yet to be finalized. We believe these are critical for understanding what the costs and savings of the continuum of care reform will ultimately be, as well as, and also critical to ensuring that children have access to supportive services regardless of the placement setting that they are in. DSS did recently release the framework that Mr. Lightbourne brought up, and it does appear to address, at least upon our preliminary review, some of our questions around how the rate structure will ensure that access. The second issue we'd like to raise is a question for DSS and how it expects to track the costs and savings at the county level to ensure that the state meets its realignment and Prop 30 obligations to not impose any unfunded mandates. And then finally, we also have several outstanding questions, as Mr. Mecca proposed, around how mental health services will be integrated with child welfare services, which we dive into a little more in our analysis of the Human Services budget. Our final note is that we do not have concern with the state operations piece of the governor's proposal, believing it is justified given the extensive workload that CCR implementation will require. And we do concur with the committee staff's recommendation to hold this issue open so that we may further address the outstanding questions that we have. Thank you.
Thank you. Anything from finance? Seeing none, is there any public comment?
Good afternoon, Mr. Chair. Tia Orr here on behalf of the Service Employees International Union. I would like to echo the comments of Mr. Mecca. I think from our social workers and public health nurses and our workers that work in child welfare services, we agree that the policy set forth in AB 403 is great policy, smart policy, and policy that is for the best of the youth that we take care of. However, we will say that in order for workers to be able to do this great policy, in order for us to make this a reality, the state is going to have to fund us at a level that we have the adequate staffing. For cross-coordination of programs, for the ability to find those home placements, for it to materialize into what I believe AB 403 was set to do, we have to have the staff on the ground to make it a reality. Unfortunately, the governor's proposal as it is to date, we don't believe is sufficient enough to cover the adequate staffing necessary. We also look forward to working with the administration and coordinating on what that amount is. We haven't had conversations too much thus far, but we're looking forward to having more. We know that we're getting close to something that could be workable, but as Mr. Mecca said, I think we have some continued work to do. Again, I would like to stress that we're in support of the policy. Workers are fully committed to implementing the policy on the ground. We just need your support from the state to make it a reality.
Susanna Niffen with Children Now, speaking on behalf of the Step Up Coalition and our relative caregivers. I just wanted to highlight something that Mr. Mecca said about the success of CCR rising and falling on whether or not we have enough families. And to find enough families, you're really going to have to reach out to our relatives and support them in a way that we haven't done in the past. I don't think you can reach these numbers without doing that. So we wanted to highlight something in the analysis that talks about how under CCR and RFA, relative families should now be treated the same way we treat all of our families, with the same respect, the same training, and the same resources provided to them. And we've been really encouraged by meetings with the department that that's the direction that their rates discussions are going in. We just want to encourage them to keep going in that direction. Thank you.
Thank you.
Hi, good afternoon. I'm Sherry Schroeder, and I'm a direct service provider. I do foster and kinship care education. I run the program for Yolo County and foster care recruitment and retention, along with being a caregiver myself of a non-minor dependent and several other 14 to 20-year-olds over the last several years. I'm here really to speak on behalf of wholeheartedly supporting both CCR and resource family approval. So as a caregiver, we've stepped in, bringing in caregivers to on the relative side and the non-matched foster care side, that as we bring more and more of our caregivers to the table, we have a capacity issue around training and education. And we do think that, I have two relative caregivers right behind me, that it is really essential that anyone who's taking care of our children are treated equally across all accounts, whether that be in terms of how we support them, how we bring them in, how we build the services around them, but also how we fund and provide them the reimbursement rates. And at this point, it's an unequal process. But I do see such a change as we brought relative caregivers into our classes and having them sit side by side. And I think several that will speak behind me will say not only are they feeling like they can do a better job with support, and if we had additional support to give and meet all of their needs, that they would be open to taking care of other children that are coming into the foster care system. So please wholeheartedly support this. We really appreciate the thoughtfulness and concur with all that has been said before us.
Thank you.
Hi, my name is Mynisha Mangrum. I started the class end of January, early February to get my grandson back. He's also in the system. Basically, I'm single, working hard, and if I was to get my grandson back, I would need help as far as child care. Me and the 30 other people in the class, all we're asking is for the support. It's kind of hard. My grandson is not my biological son, and technically I am a foster parent. So therefore, it should be an equal pay on both sides of the fence as far as whether I'm related to him or not. That we're just asking for more funding. We want to open our hearts up to more children because we do care. Everything I've seen in class and that I've learned, whether you're related to me or not, I do want to open my home to help, but I also need the resources. We have great hub leaders, Lisa, Sherry. They'll come out and help you do whatever you need, but we need more than just them. So thank you.
Thank you. We hear you, and thank you for your testimony.
Brenda Dabney with the Children's Law Center of California. I just want to, again, thank the legislature and the Department of Social Services for CCR and the incredible effort and dedication that has been behind it. We wholeheartedly support the philosophies behind reducing the kinds of placements that our child clients are in throughout the state and really giving them the services that they need. I want to echo all of the comments that have been and will be made on behalf of really supporting relative caregivers. They are going to be the key as we try to transition our clients down from these very high-level group home placements into family care in a way that is very meaningful and supportive for them. But to do that, I think that we need to make sure that we pay special attention to how we transition them down, making sure that resources are in place before youth are removed from group homes and high-level placements into the homes of caregivers who have not had a whole lifetime of foster caregiving the way a lot of the licensed foster care providers are. And so I just want to, again, for those who may not remember, over 10 years ago in Los Angeles County, we closed down McLaren Children's Center. A lot of those children were sent off to various relatives and other places to live, ended up in juvenile hall because those kinds of mental health services were not in place and those caregivers were not adequately prepared to take them in. So please, let's not make that mistake this time, and let's make sure that we support this. Thank you.
Thank you.
My name is Sarah Ibarra. I am a kinship parent from Yolo County that is going through the RFA program. I'm here to support adequate funding to implement the continuum of child care reform, in particular adequate funding to result, retain, and support foster parents and relative caregivers. I am trying to get my 2.5-year-old nephew out of foster care, whose father's going to prison 30 years and his mother has a bad drug addiction. For us to be able to do this, I'm coming from another county, Colusa County, so to be able to come back and forth, I'm asking that we be able to have funds with travel expenses or, gas cards to get us back and forth to do the things we need to do. Again, this is all about reunification. So for us to put the families back together, we do need the funding to be able to provide for these children. Thank you.
Thank you.
Thank you, Mr. Chair and members. Farrah McDade from the California State Association of Counties, representing all 58 counties, with just broad comments, echoing what Mr. Mecca said, as well as I want to thank the Department of Social Services. They've been undertaking Herculean efforts to try to meet the implementation date of January 1st. I will say the funding, the governor has acknowledged that some funding is needed, as have the speakers. We would say that we are still trying to get our arms around how much and what for and what we will be doing. We're working with, of course, the Department of Social Services and the Department of Health Care Services. It's a big issue that will require a lot of work this summer. I just do want to say it's not ramp-up funding that is needed right now. It is start date January 1st, 2017 funding that we are looking at. So that's 8 short months away, and I want to thank you for your time.
Thank you.
Good afternoon. Kirsten Barlow with the County Behavioral Health Directors Association. Similar to other speakers, we share the goal of the administration in wanting to make sure that children's emotional needs are met as you look to reform the way that their foster care placements are actually handled and are actively engaged. Really appreciate the efforts of Department of Social Services and Healthcare Services to bring into the discussion the clinical expertise of the county mental health system, as well as looking through the array of sort of technical in the weeds Medi-Cal and certification issues that we need to work through. Look forward to continuing to working with the agencies to get our arms around the quantities of children, the quantities of agencies, and what level is there an expected and necessary role for the county mental health system to play. Thank you.
Thank you.
Kim Lewis, representing the California Coalition for Youth, as well as Aspiranet, one of the largest FFAs in the state, and just wanted to echo the comments of other speakers around the adequacy of funding for CCR and whether or not we're building that into the rates and what does that look like, especially with the signing of SB3 this week, and how does it affect exempt employees, and making sure that's taken into consideration as we forecast rates. Another concern around the mental health and certification, especially when we have a shortage of providers of mental health services in rural counties, and being able to provide the services needed for those youth in foster care, and appreciate continuing to work with the department on our concerns. Thank you.
Thank you.
I'm Doug Johnson with the California Alliance of Child and Family Services. I want to echo all of the comments I've said before, but also those of Mr. Mecca. I think it's really important that all components of this child welfare, probation, foster care system are adequately funded. That includes both county staff, providers, and then the services and supports being provided by individual families, including relatives. And the equity for relatives, I think, is really going to be important, because these really difficult children who we're not trying to eliminate from group care, but move them more quickly towards permanency. We think that most of the families who are going to be willing to engage those children will have to have a relationship with them prior to placement. There are just so many families out there who are going to take children they don't know. So support for relatives and others who have that relationship, we think, is really important. And I think what Mr. Mecca said about the team decision, the team activities, both at the county and the provider and the family level, is really important, but it's not free. It will save us money in the long term by better placements, more effective and better outcomes, but it does cost money up front. We need to recognize that. Thank you.
Thank you.
Good afternoon. Danielle Sanchez on behalf of the Chief Probation Officers of California. I want to begin my comments that we certainly appreciate the proposed investment and funding provided to county probation departments for purposes of the resource family recruitment and training. I would note that this is a very exciting paradigm shift, I think, for all of us and for probation, and one that we are looking forward to continuing our work with the Department of Social Services and our county partners as well. That said, because of this shift and based on kind of how we are currently serving juveniles in our care, there are certainly infrastructure needs that we are mindful of. Unfortunately, some of those at this time, we are not aware of what those are going to look like as we continue to look at implementation of the CCR. So we would just note that we appreciate the funding provided for where we're at this point in the process, and note that as we go forward, we look forward to making sure there's continued investments and resources in this program to achieve the types of outcomes that we'd all like to see. Thank you.
Thank you.
Good afternoon, Molly Dunn with the Alliance for Children's Rights, and we firmly believe that equity for relatives is essential to making CCR work. Our relatives are the backbone of our child welfare system, and they are where children stepping down from group homes will find loving family placements. So we support equity for relatives. Thank you.
Thank you. If I could take a chair's prerogative to speak before the next speaker, I want to acknowledge former Assembly Member Bob Campbell. Not just because he was a champion for children in the state of California, but because he held the seat that I now hold, and he is a constituent. It's great to see you, Assembly Member. Welcome.
Thank you, Mr. Chairman. Bob Campbell representing the California Alternative Payment Association, and Deneen Nicoletti, who couldn't be here. She's back in D.C. testifying, so they pulled me on the mothballs to come and say a few words. And I think Frank's been testifying for 70 years. I can't remember if he's that old or not.
I think you look better than he does. No offense, Frank.
Got more hair. Got more hair. CAPA is also supportive of 403. We think within the confines of the language in 403 are a lot of the solutions and so forth, and it's really going to deal with a population that's been neglected for a long time. I can remember being here. We've been talking about foster care from the 80s to the 90s, and we're still talking about it. But it won't go anywhere without funding. You really have to have funding. You're going to ask folks to take care of folks who've been disadvantaged in their life and everything else. So hopefully in that, and I know that L.A. County will be presenting some funding also for 6 months. It's from a Sheila Kuehl, who was a member of the legislature for, God, I won't say how long, because she's lying about her age too. But anyway, so hopefully when you look at this process, you'll look at the money needed to carry out these. Thank you very much, Mr. Chair.
Thank you, Assembly Member.